Good day, this is Technology Access Television, and thanks for stopping by to talk technology with me, Bruce Montgomery. Today we're talking health, the intersection of health and technology. Well, if you're like me, you're concerned about your health and the health of your community and your family, the ones that you care about. And there is a definite role that technology plays in the intersection of health, quality of life, and impact in our communities across all of this great country, and in fact around the world. Today my guests are from an organization that has started a very important collaborative initiative right here in Illinois to change the landscape of the quality of life through health services through technology, and that's what the Tele-Health initiative is all about. Today my guests are from Broadband, Illinois, and we have the director of the Tele-Health initiative, Ms. Nancy Casey. Nice to see you, Nancy.
Nice to meet you.
And also we have the deputy director of Partnership for a Connected Illinois, otherwise known as Broadband, Illinois, Laura Lane. How are you, Laura?
Fine. How are you, Bruce?
Well, I am just as excited. We're coming off at a very exciting event. You two phenomenal women put on a great announcement of the Tele-Health initiative. Nancy, why don't you tell us about the Illinois Tele-Health initiative?
Well, the Tele-Health initiative is an effort to move telehealth forward in Illinois. And what people need to know is, what is telehealth?
Exactly.
Telehealth is a way of connecting healthcare providers and patients, and healthcare providers to other healthcare providers using technology, using telecommunications. So you don't have to be in front of your doctor face to face. You could be in front of them screen to screen, or the doctors could be talking to each other screen to screen, or in some cases over the phone or through the internet.
Now this seems like it makes all the sense in the world. I mean, we're walking around with these tablets. We've got broadband everywhere, or at least in a lot of places in Illinois. Is this saying that now it's time to use this broadband in such a way that impacts health outcomes and service delivery?
Absolutely, and they're doing it throughout the country. And in fact, in other parts of the world, they're even further ahead than the United States.
That's true.
In many ways. And what is happening is you just don't have enough doctors. It's a projected doctor shortage. There's a projected 32 million additional people that are coming in the system, and you have an aging population. So you have huge demands being placed on the healthcare system, and we need to figure out a way of not only meeting those demands, but improving the quality of care. And it's been demonstrated that using telecommunications really allows you to more efficiently use the services of the healthcare provider, and the patients like it even more. The patients like it because they feel they're getting the doctor's attention when they're looking at the doctor in the screen. The doctor's not looking around at flipping through papers and being interrupted on the phone, but they're there talking to you. And so the patients love it. The doctors, once they start using it, find it very efficient, and it's a way of cutting down costs and improving the quality of care.
Now, Laura, you've worked at every level of activism on this broadband conversation. You've worked at the community level, now you're working at the state level, and tell us about what communities, is this something that's communities are thinking about? Have you seen evidence that communities are exploring how technology can impact healthcare and healthcare outcomes in the communities that you serve and you're aware of?
Absolutely. From getting just the local Cook County Health Clinic connected to better broadband, to connect up to other Cook County agencies and to local hospitals, to networks of federal qualified health centers, connecting up to programs that help to up-train their staff and connect them with specialists so that their clients don't have to go into the hospital for that extra specialty advice. We've also seen around the state different pilots on telehealth in communities large and small, and we've seen an interest in just accessing information about healthcare. It's the #1 researched topic on the internet. So access to information just to be able to research healthcare, and then also communities needing to connect up with their providers is critical. We also see one of the barriers to quality of health is transportation. And so we see oftentimes that when you're looking at communities who have negative data on certain health outcomes, oftentimes it's the distance between them and the provider, and a busy family not being able to get to the specialist. So this could also address a lot of those issues that we see in communities where the doctor or the specialist is not close by and the travel is too much of a burden for that family, whether it be seniors or specialty care for families.
Now, you as a deputy director of Broadband Illinois, you preside over an organization that has done a huge amount of research as to where broadband is.
Correct.
And so we know where the fiber optic cables are, we know who the service providers are, but now moving into this telehealth area, this is about how people are using it. What do we know? Is there some early research in this area, or does there need to be some exploration of what the impacts of the connection of these high-speed wireless networks, high-speed cable or fiber networks, how they are impacting? Is there research in this area that your organization, Broadband Illinois, has started to do?
Well, the good thing is that, as Nancy said, because there are other states that are doing this, a lot of the research about the benefits of telehealth in particular are already out there. One of the things that Broadband Illinois has done has taken a look at how we improve our broadband networks here in Illinois. And over the past 5 years, between the investments that were made from the federal grants that Illinois secured and the private sector investment, broadband is more accessible throughout the state. We still do have a few barriers, however. 30% of our residents in Illinois don't have access at home, so if they're trying to access telehealth or do research on healthcare issues from home, it's a barrier for many Illinoisans. And then also a lot of the anchor institutions that would be involved in a telehealth pilot, not all of them have the speeds, levels, and price points that they need to meaningfully engage in a telehealth pilot. So we still have more work to be done there. We are looking for a research partner for the pilots that we're proposing so that we can talk about efficacy specifically in Illinois, leveraging our assets that we have here, leveraging the market that we have here as to how to have the best impacts on those health conditions most important to Illinoisans.
So Nancy, as the person who's been a evangelist for this conversation. I mean, you were out there waving the flag for the importance of this before people really understood what the potential impacts could be. I mean, you've been working on this for 5 years or better. Right. Now that people are starting to catch a clue, who are some of the stakeholders that are so important to be a part of this dialogue, and in fact you would want to engage with you in this Illinois Telehealth Initiative? Who are some of the people that really need to be at the table?
It's really a very broad group of people, but I think what we need to do is sort of focus down on some of the key players. I think we need the insurers. I mean, the health insurers are critical players in this because you could have all the wonderful connectivity that you want, but if nobody's paying the doctor to be treating the patient through video or other forms of communication, it's not going to be going very well.
And are they starting to, because of what Laura mentioned about the fact that, you know, Illinois is not in a vacuum. This is going on in California, it's going on in Massachusetts, it's going on. So there are some places where these insurers are saying, hey, this saves us money. This has some positive outcomes. People can stay in tune with their provider, with their care, with their management of their care process, and so this data is starting to come out.
Right. No, it's really very clear. What's happening is Illinois is a bit of a laggard in this area, and there's some good things about being a laggard, which is that everybody else has tested it around the country and they figured out how to set it up. But you're right.
So we don't have to be the revolutionaries out there at the front lines. We can pick up some of these best practices and put them into place on top of the networks that we have in Illinois.
Absolutely, absolutely. So the insurers are a key player. Not only do you have the private insurers, but also the public insurers, Medicare and Medicaid. And Medicaid's been fairly good on this. And Medicare, there's a lot happening in Congress right now to expand the reimbursement for telehealth because everybody understands this works. This makes sense. So the insurers are a key part. The providers, you have the hospitals, the doctors, people who are going to be providing these services, they need to come on board. And increasingly what you're finding is that in medical schools, people are saying, boy, I want to find out about telehealth. They want, the students are demanding it. They want experience doing telepsychiatry and various other forms of telecommunications because they understand that's really where it's headed.
Now in Illinois, we have these phenomenal research hospitals. You've got UFC, Northwestern, UIC. Here we are half a mile away from one of the biggest medical districts on the planet with Rush Presbyterian, with Cook County, with VA. I mean, all this is right here. This seems like a natural for Chicago and Illinois to be at the, not laggards, but really an early adopter here.
You would think so. But unfortunately, that has not happened.
But that's why you're here.
Right. I'm here to try to get all these academic medical centers to start working together. There's not been a long history of academic medical centers working together. Hasn't really even been a lot of history of the institutions in the medical district working together.
Wow.
In fact, they're just working right now on improving their connectivity between the various institutions. But we need to bring them together.
All right.
And actually, that's a lesson that I learned. It took me 5 years to figure this out. I was trying to figure out why it was in all these other states, telehealth moved forward at rapid pace, and Illinois is one of the last ones. And I finally figured it out. I was told just about on day one when I started doing this that the reason telehealth has not moved forward in Illinois is because we have so many competing medical entities, competing medical field, and so you have a number of
collaboration
players.
Is something
collaboration is not on the table for these folks, because they're competing with each other.
But this is changing, and in fact, Laura, one of the groups that you brought to the table at the press announcement for this were the tech community.
Right.
And so now we have all of these app developers, and they're creating the kind of solutions that would ride on top of a broadband network.
Absolutely.
And so talk about this Matter organization and how did they respond to this conversation of there being a telehealth initiative, and what's in it for them in terms of the creation of these apps that can, or these tools or these software, cloud or whatever, that can benefit from a telehealth or a medical service delivery environment.
Absolutely. Well, Matter is a tech hub for health startups in Illinois.
And where is it located?
And it's located in the Merchandise Mart.
All right.
Merchandise Mart Plaza, right next to 1871, which is a digital technology hub. And they just launched with 70 companies, and 6 of those companies are squarely in the telehealth space.
Wow.
And stood up for us at the press conference, ranging everything from nutrition to diabetes to stroke to therapy, and taking a look at how to leverage telecommunications networks for that delivery. And this is really critical because part of what's going to keep Illinois competitive, both from an economic standpoint and a health delivery standpoint, is the right implementation of telehealth in Illinois, so that we can retain companies that are coming through Matter, because Matter is attracting a lot more attention nationally, and so that all of the companies who have been piloting telehealth throughout the state, and I think with the meetings that we had with the Governor's Office of Health, Innovation, and Transformation, we identified almost all of them and had them present in front of the key stakeholders at the state level. We need to keep them in Illinois. We need to keep that innovation here. And there's a huge opportunity because of the rich asset that we have in our academic medical institutions. We have a pretty knowledgeable, consumer base here as well. I mean, it's just and then we have the assets of the technology, and now we have a major hub for attracting innovation to the networks. We have the second largest investment in a public network in the country. I mean, so we have a lot of assets that if we can get these aligned properly, we'll be in a very good space to both leverage the national understanding of the benefits of telehealth and really drill down to those outcomes that are going to be most important for the health concerns that we see here in Illinois.
I can remember when I was coming out of school that people were always saying, well, if you have to fall back on a job, you could always go into pharmaceutical sales. And we had Baxter Labs, we had Abbott Labs, we had GD Searle, we had all of these hugely successful and profitable and fast-growing pharmaceutical and medical device and medical technology companies. And Illinois was looked at with awe that we had all these companies here in Chicago, and they were hiring and growing, and the residue of that is still here in Chicago and still in Illinois. There's a lot of leadership from those communities, and so I could see this having a rebirth now because these type of technologies. When I was early in my computer career and working with some of these companies on the computer side, they could only have dreamed of there being an internet and broadband communications and wireless communications where they could connect primary care and nurses and behavioral care services. And I think this gets into some of the impacts that people don't often think about, because there's a connection here between health outcomes and education. I mean, what is this? What's the impact on providing behavioral health services into rural areas with schools and those types of things, so more people who may need a range of services that could find out they could get these services all across Illinois?
Yeah, it just is amazing. It could really transform healthcare in Illinois. There's a lot of issues that are where everybody is losing right now in healthcare. Everybody's losing that. Nobody's gaining by it, and I sort of
because people only stop and talk about money, and it's always money, money, money. But here's a way where innovation could mean that there could be higher quality service delivery for less money.
Remarkable.
That have better outcomes.
That's right. It's
because when we look at systemic health challenges, and that's what's sometimes so frustrating is, and Laura and I talk about this a lot because we both live on the south side of Chicago, and when you look in direct proximity to some of these great health institutions, you find the highest incidence of asthma, highest incidence of heart disease, highest incidence of diabetes, and all these things. You say, my God, what's the use of having Nobel Prize winning scientists and everybody's sick? So there must need to be something that needs to be done to drive better results, so that we could see things heading in the other direction. And I think pushing these tools out to a broader range of people. And I just had a presentation the other day where Cook County Board President Tony Preckwinkle reminded people that Cook County Hospital is now Cook County Health System. And they are a health care provider, not of last resort, but they have also County Cares, which is a big Medicaid health insurer and provide services. So their clients now are going to a range of, so they put more people into the system, as well as they're competing in the system, as well as they have the very clinics that you mentioned. And so now the whole way services delivery, because of the innovation at Cook County, is changing this whole paradigm. So it's a perfect time to inject the use of technology and this kind of thing to the table. So let's talk a little bit about what happens next in this initiative. How does this become more than a good conversation and an effort that actually starts to produce some results? What is your plan?
Well, I think what we need to do is to bring together the key stakeholders, which includes not only the health systems and various other systems, but it also does include corporations, the insurers, and the corporations. There are a number of corporations, large corporations, not the startups, but large corporations that are interested in doing this. Walgreens is rolling out telehealth across the country.
Walgreens?
Walgreens.
In
partnership with MD Live, and they've started in Michigan, started in California, and they plan on rolling it out. There are 700 stores here in Illinois.
Wow.
And so they're very much interested in this, in educating people about what this opportunity
and
is.
they've got the, they're probably the largest prescription service delivery person on earth, and then they have clinics, and then they have so many different things in a lot of their stores, and they're in every community in the country.
That's right. Yeah. So you need to bring these folks together to talk about this, because I'm not sure everybody even knows what the other people are doing. That was sort of the impression I got when we had our meetings
So
last
then the
fall.
Tele-Health Initiative will potentially have a series of either summits or conversations where these stakeholders come to the table and say, hey, here's what the potential is, and kind of self-define what outcomes could come out of this.
And the next thing that needs to happen is we need to do demonstration projects. And I find this very interesting because it's really been demonstrated throughout the country that this works, but I think there's a resistance in Illinois to, can it really work in Illinois? I know it can work in Massachusetts, I know it can work in Wyoming, but can it work in Illinois? And so we need to demonstrate to people, and people need to see the impact it could have on their lives, and so that they could be knowledgeable about it and then be advocates for it.
Now, Laura, we have some seem like communities would just jump up and want to take advantage of this. I mean, we've got urban opportunities here in Chicago. We've got this phenomenal state-of-the-art network in Champaign-Urbana, where they have this next generation gigabit speed network there in that community. I could see a number of these broadband communities that have been enabled by the Broadband Investment in Illinois wanting to pilot these type of applications to bring another use case to the table as to what's in it for consumers, what's in it for docs, what's in it for reducing costs and these kinds of outcomes. Do you think that was the response to the kickoff of this, did you start to get those kinds of calls that people say, well, tell me more, and what can we do to be involved?
Oh, absolutely. And then we have some communities that have been leaders in this front, the Illinois Rural Health Net, for example, and SIU, Southern Illinois University, has been a leader in making sure that the lower 20 counties are getting organized and engaged and ready for the benefits of telehealth. So we have a lot of champions throughout the state and in communities who are already in the lead in terms of where they are with their connectivity and making sure their anchor institutions are connected up so that they're ready for the rollout of the next generation applications. So yes, and then we also have not only the small startups, but you were right on the money in terms of pharma, because pharma folks are the co-chairs of the Matter Board. And so they see where this next generation of applications is really key to innovation in their organizations. And Abbott Laboratories has AbbVie, and you know, I mean, so there's a recognition that this is the next frontier. And so PCI is very glad to be able to connect up the adoption story with the importance of adoption of broadband to the critical pillar of healthcare and meeting a lot of those outcomes for our communities. And we are hoping that this helps us leapfrog over these years of sort of disinvestment and having trouble changing the paradigm of how things are funded. So if we can change the paradigm of how things are funded, then you don't have the same competitive environment. You have a system that promotes more collaboration because they're win-wins. And so that's why it was really important that we leveraged Nancy's research investment and understanding what some of those potential win-win platforms are. And you mentioned one of them already, which is behavioral health with children. That's a very key platform where we're not servicing the need currently. There's a lot of opportunity there. If anybody's in tune to technology, it's kids. So there's a lot of opportunity for win-wins in that platform. Another one that is very close to my heart is prisons and jails and behavioral mental health care there. There's another platform where there's a lot of win-win opportunities, and our Department of Corrections has actually been leading in this front, and that's an opportunity where there are a lot of win-win possibilities, both in our jails and our prisons in the state of Illinois. So that's another one of those platforms.
So as we wrap this conversation up, and it's been a delight to have both Nancy and Laura here today, can people who are listening to this, whether they're educators, whether they're people from the medical community, whether they're people from the technology community, how can they get in touch with this initiative? And if they want to be involved, they want to make a contribution, they want to show up at the summit and sound off about some ideas, how can they connect with this initiative moving forward?
Sure. They can go to our website, broadbandillinois.org. And there they can get more details on the Tele-Health initiative. So you'll see that it's one of the featured stories right on our front page. There's also a Get Involved button, so they can just click that button and leave their contact information. And then if they want to do the phone methodology of telecommunications, they can contact us at 217-886-4226. That's 217-886-4226. We want to be open to all modalities of communication.
All right. Okay. Very good. So there's a Facebook page. There's
Twitter handle, Broadband Illinois. Yes.
So find Broadband Illinois. Broadband Illinois is a way to get in touch with this telehealth initiative. And telehealth is any way you can think of leveraging technology in ways that will create better health outcomes, from your own personal activities where you may have a health opportunity that you want to engage your medical profession, your healthcare community. This is what it's all about, putting this infrastructure to work in ways that mean better outcomes of quality of life. I'm so delighted that Laura Lane and Nancy Cases could join me today, and I'm delighted that we are still here talking about new opportunities of technology and investment here in this great state of Illinois. My name is Bruce Montgomery, and this has been another edition of Technology Access Television. We'll see you next time.